Hello. So hip pain and tight hips are something that a lot of women struggle with, both during pregnancy and even when you're not pregnant. Like, I have had tight hips when I'm not pregnant, and especially my right hip. One tends to be worse than the other. And it just gets worse when I'm pregnant. So what I want to show you today is just educate you a little bit on why that happens and what the long-term solution is, but then also show you some kind of quick fixes that you can use in the short term to get some relief. Okay. Also, I have a microphone on. You can see it's wired just so you can hear me better, but we'll see how that goes when I actually start doing the stretches. So, first of all, I'm sitting in a folding chair, like a nice firm thing. So these stretches are good for when you're pregnant and when you're not pregnant. But what tends to happen, one of the main reasons why our hips get tight or uncomfortable is because we're not using our bodies properly. So it has to do with poor core strength, basically all the same things that lead to diastasis recti and pelvic floor function. Like it's all interconnected. So that's why it's really complicated to just say, hey, I have hip pain, what do I do? And you're like, oh, you do this and your hip pain goes away, because it's usually never that simple. It needs to be a whole body fix, so to speak, a transition. So you have three parts of your body that really make up your core. So you probably heard me talk a lot about the transverse abdominis, which is one of our abdominal muscles that starts at our spine and wraps all the way around to the front, connected with connective tissue. Now, what happens with diastasis recti is that connective tissue gets stretched. Obviously, in pregnancy, it's easy to see why that would happen, but pregnancy is just one factor. It's basically anything that increases the intra-abdominal pressure will stretch that over time. And that's pretty much bad posture, the way we stand, having a sedentary lifestyle, all those things contribute to it. So pregnancy just tends to be the straw that breaks the camel's back for most women. Men can totally get this too, though. Now, but that's not the only thing that we work on. Obviously, this makes it hard. This is our God-given girdle. This is what holds everything in and up. And it's made a huge difference in improving my diastasis recti with my pregnancies. Like my fifth and my sixth pregnancy, this is my sixth pregnancy, have been way better than my fourth pregnancy when I first learned about diastasis recti and realized I had it pretty bad. So, and it also has to do with your pelvic floor health. So if you pee when you cough or sneeze or laugh, you can't jump on a trampoline without wearing a pad because you're going to pee your pants. Those things are not normal. You will tell a doctor, and I just talked to a friend who's about 8 or 9 months postpartum, and she was telling me she knew about diastasis recti from my blog, and hearing me teach about it, she knew she had it because she checked herself. She talked to her doctor, her primary care doctor, and told her doctor, and her doctor, like, no joke, her doctor's like, well, there's nothing you can do about it. That's just the way it's going to be from now on. So don't accept that as an answer from your doctor if they do it. And she didn't. She called back the next day and insisted on getting a referral to a physical therapist, and picked a specific physical therapist that she wanted a referral to that has specializes in women's health, pelvic floor issues, diastasis recti. So she's working on that. So that's awesome. So anyway, not only is the transverse abdominis important, though, and this is where our hips get into play, but our glutes, there's three gluteus muscles: the gluteus maximus, the gluteus medius, and the gluteus minimus, I think it is. So basically big, medium, small. And they all do slightly different roles. The maximus is obviously, like, they're the meaty ones you think of. They help you hold you upright. The other two, they do too, but they also help a little bit more with the side-to-side movement of your hips. All of it is important. And then the third part that's really part of our core strength is our mid-back. If you have mid-back pain or like back pain at all when you're pregnant or otherwise, then one of these three things is weak. Probably all of them, to be honest with you, because that's most of us. Like I haven't really even had that much back pain in this pregnancy because I've been working on all three, and it's been awesome. So, hips though. So what happens is that when any of these areas is weak, so like when your glutes are weak, then other parts of your body compensate. And one thing that can compensate is your hips. So your hips, your hip muscles and all the muscles in this area will clench basically to help hold your body upright. And that works, you'll stay upright, but that is not ideal because that's not their job. And so over time, since they're constantly clenched when they're not supposed to be, then they can tighten up and shorten and get tense, and you can lose flexibility and mobility. That's the way with all things with our body, whether we're talking about blood sugar, whether we're talking about mobility, like whatever health issue it is. If your body is so wonderfully designed by God that it can compensate for things that are not ideal for a long time. And that's probably the genetics, how long. Some people obviously can do it longer than others, but eventually it's going to give out because it wasn't designed to do that job plus its own job. So that's the way it goes. I don't know if you can hear my 2-year-old screaming in there. Daddy is in there, so she's just unhappy about something. So in any case, so that's it. So I think I found with my hips, I had been stretching them before I got pregnant, so I could tell a significant difference in how loose they felt, which definitely helped relieve the pain. But it wasn't until I started working on I think it was my glutes in particular, although I was also doing my mid back and my core, of course. I've worked on my core for a long time. But when I started adding my glutes in a tummy safe way is when I really started feeling that improvement in my hips more than just like day by day. So let me show you some of the things. First of all, this is a little hack for when you're pregnant. You don't necessarily have to do this when you're not pregnant, but you can't really tell, but I'm getting big. I'm almost 30 weeks, and I get round ligament pain. So the round ligament is a ligament that helps hold your uterus upright. So it goes from down here up to like kind of around here. So basically it's from the base around the hip area. This is why it can affect your hips. This is why we're talking about the round ligament right now. It's because it can be affected by tight hips and it can affect tight hips. So normally they're like really short because your uterus is small. But when your uterus stretches, you can see how big they can get. And I can feel mine is tight. Usually one is tighter than the others, and I've read that it's usually, for most women, it's usually the right round ligament that's tightest. So what we want to do is we want to massage that round ligament. This is the first pregnancy I've been doing it, and I don't know why I didn't before. But basically all you do is you just kind of start really close to the bottom of your belly, and you just kind of rub your hands, kind of push in. So I'm pushing in with moderate pressure, and I'm just looking for a tender spot. Sometimes I found it. It feels like little lightning, or like you hit a nerve or something. That one wasn't so bad. Since I do this multiple times a day. If you have a hard time and can't find anything, I find that when I was first learning how to do this, it was easier to do when I would have a Braxton, there's a spot right there, when I had a Braxton Hicks contraction. Because when the uterus was firm, it was easier to find those tender spots. So you can start by practicing that way. But what you do is once you hit that tender spot, you just hold it for a couple seconds until it kind of releases. You go all the way to the top. Oh yeah, up the top here is usually sore for me, so I can feel that. And just hold it for a couple seconds. Maybe roll around a little bit if you feel like you need to. And then it kind of goes away. A little bit. It's still a little bit tender, but I can tell it's less tight than it was. And so that's called releasing it. So you kind of release the round ligament. I'll check my left side. Usually my left side, I feel it. Sometimes lately I haven't been feeling it, but this is the first time I've done it today. So since I got up this morning. So, yeah, there's my left one. So this is good because when you release the ligament, then it can relax a little bit. It's not pulling. It's not pulling on your uterus. It's not pulling on your hips as much. So that can be good for baby position because, you know, if you're having issues with your baby being head down or in the correct position, then that can, sometimes it's because your round ligament is pulling so tight it's kind of twisting your uterus or keeping it in a shape the baby can't move as easily. So that helps. It's also not going to be pulling on things that are pulling on your hips as much. So that's good to do if you're pregnant. If you're not pregnant, you can skip that step because you probably, you know, they're so small you're probably not going to, you might not be able to get to them anyway. So once you've released that, here's some of the hip things. These are the ones that I started out doing. First of all, so I'm going to get cut off a little bit because of the way this video is set up and I have to stay close because of the microphone. But the first thing we want to do is stretch the back, stretch our hamstrings, because when these are tight, these can be tight too. And so if these are tight and these are tight, they're fighting against each other. Then if we want to loosen up our hips, we have to loosen up the hamstrings too. Otherwise, the hamstrings are just going to be fighting to keep your hips in the same tight position that they've been. So you basically just lean over on something. Now remember, I have been stretching this way for years, literally years. So it's pretty easy for me now. If you can't get down this low, don't, okay? Like you can see, I'm at a 90-degree angle. That's really as low as you want to get. If you go any further, then you start getting into a back stretch. We don't want to stretch the back. Where you should feel it should be in the back of your legs. And you can see how I'm keeping what they call a neutral spine. So there's a little bit of curvature, but I'm not like this. I'm not like arching my back. I'm not hunching my back. You just keep it nice and neutral. Okay, if you can't go down that low, that's fine. Just do like this, you know, whatever you want to reach onto. Some people are going to feel really tight, a really strong stretch, just like this. That's fine. That just means your hamstrings are tighter. You just do it every day, a couple times a day. They will loosen up with time if you work on it, okay? That's how stretching works. Whatever you do the most wins. So if you can get down this low like me, something you can do to make it a better stretch is kind of just slide your butt back a little bit. So like that's how I get a good stretch. So I know it's hard. Let me see if I can scoot this over. So I start with the 90 degree, but then I keep my feet planted and I just slide my butt back a little bit. Okay, that feels really good. You don't want to hurt yourself. You just want to get that good stretch feeling. You can do that for as long as you want, really. Another thing I do, which you won't be able to see, is I do my calves. So I put one foot back, keep one foot forward, and you can feel it in your, this part of your calf muscle, because it's all connected. You know the song, I'm going to get it all wrong, the knee bone's connected to the ankle bone, I don't know, whatever. But it's true, everything's connected. And so when one thing is tight, there's other things in your body that are tight. And in order to effectively loosen the one thing, you're going to have to also work on loosening other things too. So I just do that calf stretch with both legs. Okay, that's good. So that's how I always start. Sometimes, especially when I was starting out, like when I do these stretches and then I'm done, when I finish, I feel loose, like I'm going to fall over, like I can't hold myself up. And that's your body's relearning process, because that's just a sign that your body has been compensating using the wrong kind of muscles to do jobs they weren't designed to do. And so when you loosen them up and they're not clenched anymore, your body's like, what do I do now? How do I hold myself up? And so this is the long-term strategy, is learning, is we can stretch the things that are tight, but we have to be, in the long term, we also have to be, working on the things that have not been doing their job, and strengthening them and reteaching them how to do what they're supposed to do. So this is the first hip stretch. It's basically, well, can you see me? I know my pants are kind of, these are my pajamas. I haven't gotten dressed today. You basically take your ankle and just put it like just behind your knee. You want to be careful because you don't want to do this. You don't want to like put your foot there so that your ankle's like twisted at this weird ankle and at this weird angle, and then your knee starts to hurt. You don't want to hurt your knee. You don't want to hurt your ankle. You want to keep them as comfortable as possible. Again, remember, I've been doing this a long time, so I can just do this, and it's easy for me now, but it wasn't when I started. So when I started, I looked more like this. Like this was as far as I could get because my hips were so tight. So that's fine if that's all you can do. That's what you start with, and you move on from there. So, but you just do that. You hold it just until you start to feel the stretch so that it feels good. You don't want to hurt yourself. You don't want to push it till you feel pain because then you can cause injury. Just do it a little bit. Now, if you feel like you're not getting enough of a stretch, then once you get it in a position that's comfortable, you can lean forward a little bit, and that kind of gets it too. One thing I like to do is sometimes I kind of move around and find, well, where's the best position that feels like the best stretch. Sometimes I like leaning away from it because then I get a stretch in the hip, but I also get a stretch in the side here, and I can tell that this is tight and this feels good to me. So you can try that too, but just kind of move around and feel where does it feel like you're getting the best stretch. And make sure whatever you do to one side, you always want to do to the other side. And often you will find that one side is tighter than the other. So you can see that even like my left leg was pretty flat. My right leg's not quite as flat. This is the hip that I always have the most trouble with. This is the one that's the most tight. And you will probably find that for yourself too. So even though I have been stretching this way for years, I still find that my right hip tends to be tighter. And also I haven't been stretching really well since I had my stomach bug 2 weeks ago. I haven't been stretching or exercising that much like I normally do. And I can feel it right now. So I'm definitely feeling a good stretch in my right hip right now, much more than my left hip. But even that is better than it used to be, because I used to, if I skipped stretching for only 1 or 2 days, then I could tell right away. Like my hip would start to lock up, it would start popping more, and I could just kind of feel like a discomfort in it. But even though I haven't been stretching for 2 weeks, I haven't been feeling that discomfort. My hips only popped like once or twice in that whole 2 weeks, and it's been okay. It hasn't really felt locked up. So that's good. And so you can do that a couple times. And again, this is a great thing to do just throughout the day. I do it a minimum of once per day, but if you could do it at least 3 times per day, or as much as you want, then that's great. You really can't do it too much. So let me think. The other one. Okay, so these other ones you have to kind of get on the floor for. And you don't have to do all of these all the time, but pick your favorites. So that's not as much anymore, but that's the one I started out with. So these are the ones that I do more now. These are a little more challenging when you're starting, I think. So just because it's kind of a weird position. So with this, the first stretch, we were kind of stretching this part of our hips. With this one, we're going to be stretching that part of our hips, but also this part of our hips. There's a lot of muscles in your hips. So this one, again, with the one in the chair, you want to be careful of your knees, be careful of your ankles. So we're kind of putting this in front of us. This feels like, this is a really weird position it took me a while to get comfortable doing this, just so you know. And you slide out your back leg, okay? The closest you can get to kind of like a right angle in the front here, that is most ideal. But again, when I started out, this is kind of what I looked like. This is as far as I could get my leg. So just to give you perspective, all of it's okay. Put your leg wherever it is that you feel the stretch in your hip, okay? What you should feel it mostly is in the bent leg. You should feel it back here in your hip and glute. And for your back leg, of course, being stretched back, it's like this. And I'm going to turn sideways so you can see what it looks like from the side. Whew, it gets me a little out of breath since I'm pregnant. Okay, so you can see it's just stretched out like that. Now, one thing that's super important is the position of your pelvis, okay? So if you feel you have, those two hip bones, we usually call them, and when you are stretching like this, so I'm going to switch to my other leg just to get an even stretch while I'm showing this to you. But make sure you do this, you pay attention to this every time you stretch, is both of these hip bones should be equal distance to the ground, okay? And so as you are doing it, just be aware, because the temptation, I will tell you, the temptation is going to be that whichever leg you're stretching, that you kind of lean to that side. If you lean to that side, then this one is going to be far from the ground, and this one's going to be close to the ground. You don't want to do that. It's better to get less of a stretch and keep those hip bones parallel to the ground than it is to keep them cockeyed and feel like you're doing a better stretch, because you're not, okay? You want to keep them parallel to the ground as you're stretching. And you can even see, maybe you can see, I don't know in the video, but my right leg again, you can see I can't get that one out to a 90-degree angle. I can't get that as far out as I can my left leg, and that's because my right leg is always tighter. So that's normal to find that one is looser than the other. Okay, here is the other stretch that I do. It's kind of a reverse Indian style. So, you go like you're going to sit Indian style, but instead of tucking your foot in, you put it on top of your knee. If you can't do this right away, it's okay. You do what you can. Remember, you're tight when you're just starting out. So you just kind of stack them. Again, you want to be careful with your ankles and your knees that you don't injure those joints. And this one I really do like, just kind of rolling around. You want to keep your back straight. We're not like hunching and doing this, okay? We're keeping our neutral spine, just like I showed you when we were doing the hamstring stretch. And we're just kind of like, as a unit, we are kind of rotating around and being like, where does it feel good? So like, it feels good here for me when I'm over here. It's probably gonna be different for you, but, and then when I'm over here, it feels really good back here. A little bit up here too, but especially down here, it feels really good. Okay. Whew. Pregnancy, out of breathness. Then I just switch and do the other side. And it looks like you can't see super good in the video, but I can't, on this side, again, this is my tight hip on top now. I can't get this knee all the way down to my foot, but on its own. There, you can see. So see, the other side I could. This one, like if I push it down, I can do that. And that's okay, as long as you don't feel like you're, making it painful, because we don't want to cause injury. And then I just kind of, I like to rotate around too. Ooh, yeah, I can definitely feel I haven't been stretching in a couple weeks, but it feels really good to do it. It's just nice to kind of sit here for a little bit and for as long, like if I wasn't just doing this video, and I know you don't want to sit and watch me stretch the whole time, so I might sit here a little bit longer and do this right side. And you can repeat, you can do them again, however much time. Often I will just do each of these stretches once in the morning, and then try to do them, throughout my day, make it a part of the routine, like maybe right after lunch, right after dinner, right before bed. When you're just starting out, it's good to do it more frequently. Once your body's kind of used to those stretches and has loosened up a little bit, especially if you're working on those other strengthening muscles, then you can do it once a day and be fine, or even like I've done and skip a little bit and still be okay. Now, the last thing that I've just recently started doing, and this isn't I guess it's I don't know, it's a stretch, it's a movement. It's been feeling really good. I don't know if it's just because I'm pregnant and it's opening my hips or what. But I got this from the mamastrong.com, which is a really excellent fitness site with like 15-minute-a-day workouts for moms that really focus on those 3 core areas. And she's a wealth of knowledge. It's a really affordable membership. But she calls this Move the Pendulum. So you basically, you get on all fours. I'm going to do this way so you can see. Neutral back, 90-degree angle, you know, head straight. We don't want to be like this or like this. Although often, and you're probably like this because you're looking at me in the video. That's okay. But when you're doing it on your own, you want to keep a neutral spine. Your knees spread a little bit. You want your hands kind of below your shoulders and your knees like in line below your hips, okay? So we're just kind of squaring ourselves as much as possible. And then this kind of helps with the smaller glute muscles that help with the side-to-side movement of our legs. You just pick up one leg and move it out and bring it back in. Pick up the other leg. It's just like an inch off the ground. Move it out, bring it back in. And I'll show you from the front so you can, I don't know, just get a different angle. So it's pick it up. See, I'm not picking it up very far. Move it out, bring it back in. Pick it up, move it out, bring it back in. I feel a little clicking in my hips when I do this, which probably because I haven't been stretching. That's okay. But I don't know, I just like this. I feel like it helps open up my pelvis, which is good for pregnancy and baby movement. But it's also opening up my hips and helping with my glute strength and helping with my hips to open up my hips and loosen them up too. So you can just kind of do a set of those, you know, 5 or 10 on each side, whatever you want to do. So I've really been liking those a lot lately. So anyway, those are my hip stretches. And remember, these are great things to start with, but if you find you're not making the progress that you want or you're not getting the results, you remember there's that other component too. So there's the loosening, but there's also the strengthening of the muscles that your hips have been compensating for. So to get the best results, you want to work on both of those things, but you don't have to work on them both at the same time. It's perfectly fine to work on the loosening and stretching first and then focus on the other stuff later. That's kind of what I did, and it worked out for me. So if you have any questions, feel free to let me know. Otherwise, happy stretching.